What's up, guys? Just focusing the camera here.
Dance with me under the diamonds. See me like breath in the cold. Sleep with me here in the silence.
Hey guys, what's up? Dr. Kyle here again, and today's episode is going to be about back spasms, or when you tweaked your back or you felt like you've overdone something, such as picking up something heavy, or you moved or pushed or pulled something and then you felt like you tweaked on your back or you pulled something. Your back is spasming, it's like throbbing, and it's very tender to the touch. If you feel like you have numbness and tingling or pain going down your legs and it's been constant for these past 3 to 5 days, pain is not changing, and especially if the pain is going down your groin all the way down to your toes, I would highly recommend you to see a healthcare professional right now. That way he or she can help you determine what's going on with you. When you lift something heavy, that just means, I'm just going to simplify everything, that just basically means that your back has, it can't carry the load anymore. It's either very fatigued, or it's your back telling you that it can't handle the load anymore. Number two, it's also telling you that your muscles are irritated because it's protecting your spine. And that's why sometimes it's called muscle guarding. It's a defense mechanism of our body to protect us, because at the end of the day, guys, our body will always try to find means to protect us. But sometimes when our body tries to protect us, it can lead to pain, it can lead to other negative effects on us. So I want to teach you how to combat these effects and tell your body like, hey body, relax, calm down, we're good. I'm aware that I've tweaked my back. Thank you for telling me, but you can relax now. The first acronym is PRICE. P-R-I-C-E. The price is right. P stands for protection. R stands for rest. I stands for ice. C stands for compression. And E stands for elevation. I repeat. P, protection. R, rest. I, ice. C, compression. And E is elevation. Me and my cousin Zoe, we've actually made a video about this with ankle pain, and we've also used this concept with PRICE because it's very useful. We have a simple acronym so you guys can remember it. It's called PRICE. So P again stands for protection. Protection means that you need to protect your back first and foremost. Meaning, please do not lift something heavy. Don't go through the pain, or when you feel like you're in pain, you're just gonna pop a bunch of painkillers and go through it. No, you have to rest, because you may have strained your muscles. You may even have torn some muscle fibers. Your back muscles are not ready to do anything yet. And there's also a huge chance that you may have popped some little tiny blood vessels, which causes more swelling. That's your body telling you to give it time to repair itself. Listen to your body, listen to your pain. Even if the best physical therapist in the whole wide world, the best doctor in the whole wide world, will never beat you as far as listening to your body. So pain is a message or a signal telling you to calm things or to ease things up because there's something off. Number two, R is rest. So with that said, I want to teach you things that you can do to help you ease up your back. Let me grab you that spine model. That way you can have a little deeper understanding of what I mean by that. Ta-da! Back with my spine model, guys. This is your head, and this is your neck, and then this is your mid back, and this is your lower back here. Your neck bone needs to have like a curve a little bit going inside, and your mid back goes a little bit outward like this, and your low back needs to curve out a little bit inside. And you need to be able to simulate this as much as possible. That's why physical therapists, doctors, chiropractors always mention good posture. It just means that you need to do your best to assume this position at all times. Or if your low back is hurting, when you sit down, I would recommend using a towel to maintain the curvature of your spine. You need to be able to at least maintain the curvature of your low back, because this is the body part that you need to protect. I made my own towel, rolled up towel. I put duct tape on it, and this should help maintain the curvature of my low back. You put the towel above your belt line, and make sure you're always maintaining a good posture when you sit down, watching TV. Make sure you're not allowing your position to slouch as much. That puts your spine in a compromised position. If your spine goes forward like so, weight is not distributed equally throughout your back, and it goes directly to your low back, and your low back takes the grunt of the load, and you don't want that. Well, you can also use ice while you're doing this. You can put an ice pack, put ice inside the Ziploc bag, crush it with a hammer, make sure that it's malleable, make sure that it moves around, and then you put it behind your back. And you make sure that the ice doesn't go directly to your skin. There's at least 1 or 2 pieces of clothing between you and the ice pack. I'm also going to put contraindications, or things you should be aware of doing before you use ice, especially if you don't have any sensation or if you have conditions that you're not supposed to use ice. After 1 to 2 days, you feel like the swelling has gone down, your muscles are not tender to the touch, proceed to heat. The reason why you want to use heat, because it brings blood flow to your back, it brings oxygen, it brings nutrients, because remember guys, blood carries oxygen and nutrients to your back, and then it creates a healing environment to your back, which speeds up the healing process of your muscles. I have this sock right here because if you don't have a hot pack at home, you can definitely use your own homemade hot pack. Put rice inside the sock, uncooked rice inside the sock, tie the sock, and then you microwave it. And that's going to be your homemade hot pack. And then you put the sock behind your back and make sure you have a couple of layers, 3 layers of clothing at least. Make sure that it's not too hot, it's just warm. Don't burn yourself in the process. Heat for 15 to 20 minutes and don't go over that. For ice, you can use it throughout the day, but make sure after 15 to 20 minutes of using ice, take it out, wait for an hour, and use again. You can definitely use it throughout the day with breaks. I would also recommend using an alarm clock. That way every 15-20 minutes you could take out the hot pack, you could take out the ice. That's for sitting, and for laying down, let me show you how it's done. Hey guys, how's it going? So this is a sleeping position that I would recommend. Remember price, P-R-I-C-E. E is elevate, so you can elevate your legs to relax your back as much as possible. It also brings blood flow back to your heart, and it helps with circulation and blood flow. You notice here that I have a wedge. If you don't have a wedge, you can definitely use pillows, so 2 to 3 pillows right underneath your legs. I'm only using 1 pillow because this helps me maintain the curvature of my neck as well. It doesn't crank my neck up, or it doesn't put my neck up in a very extended position. So 1 pillow is good, and then elevate your legs. Okay, cool. If this is painful for you, you could also try sleeping on your stomach. Let me show you. If you didn't like that position where you're laying on your back, you can try laying in your belly with a couple of pillows underneath you. Try going conservatively and use 3 pillows. Put it right underneath your stomach area. As the day goes by, it gets a little bit better. You can reduce the number of pillows as much as you can until you can sleep completely without it. See what works best for you. All people are different. Let me know how it goes. I know we didn't hit compress as much on your back. Normally you don't really put compression on your back. It's more geared towards your feet or your ankles, because you could actually wrap something around it, or your legs. You can definitely wrap your back, but most of the time you don't really need to put a wrap on your back. The heat or the ice should help. I can talk in this position because it's actually comfortable for me. That's about it, guys. Thank you very much for being with me here today. I really appreciate it. If you have any questions, shoot me a comment. It would really help me if you like this video, subscribe, share it on Facebook, share it with your friends, share it with your family to gain more coverage, so we could also help other people at the same time. Have a good weekend. Stay safe. I'm always here for you, and I got your back. Bye.
Dance with me under the diamonds. See me like breath in the cold.